Hi guys, Dr. Matt here, and today I want to talk to you about this silent epidemic that's developing. This is the epidemic that is affecting almost all Americans today. It's the epidemic that is causing pain in people. It's the epidemic that is silent and people don't know about until it's too late. And this is osteoarthritis. The reality is right now that 96% of adults 80 years old will develop arthritis in their life, according to the American Journal of Neuroradiology. 85% of adults by the age of 50 are going to develop arthritis. So it's not a matter of if, it's a matter of when. And it's come to epidemic proportions right now because more people than ever before are having joint pain. And we're seeing this in this so-called opioid epidemic, because we're just treating these joints and this pain with pain relievers rather than getting to the root cause of the problem. And what really is kind of upsetting about this is that the CDC is well aware that arthritis is here and it's going to double by the year 2020. And not much is being said about it or mentioned about it. There's not a day that goes by that we don't get an inquiry about somebody that has joint pain, knee pain. In fact, I had a patient just yesterday come up to me as I was taking care of her. She goes, "Doc, I can't believe what we saw on my x-rays. I can't even believe all of the degeneration that's on the joints." I said, "Well, why is that? Why can't you believe that?" She goes, "Well, I don't have any pain. I didn't have any issues until the last 2 or 3 months. So how can all this degeneration develop in my spine and on my joints if I haven't felt it almost my entire life?" I said, "Well, let me ask you, have you felt it? What things have you noticed? Like, have you been stiff? Have you been sore? Have you ever had back pain in the past?" "Oh yeah, I've had those things in the past, but I've just always ignored them." And I said, "Well, those are warning signs that degeneration is developing in your body." And so we're working with a spinal hygiene movement right now to change the face of osteoarthritis. The problem is that we're working against this perfect storm that's beginning to develop, because arthritis, degenerative disc disease, joint disease, this is a silent disease, okay? And nobody has really any interest in changing it right now because back surgeries cost about $100,000, very profitable. Okay, very profitable over the lifetime of a patient to do lots of back surgeries. Also, the back pain pill industry is very profitable. They make billions upon billions of dollars. And there's not a lot of interest in changing and preventing this from happening. You see, this happened in dentistry back in the early 1900s. And what dentists noticed is that teeth were just rotting all the time and they were just pulling them left and right. Their job were teeth pullers. Until a dentist by the name of Alfred Phones came along and said, "Well, there's got to be a way to prevent this from happening." And years before that, they had found out that there was a bacteria that was from food that caused acid to eat up the teeth, as we know today, right? And so he said, "Well, if I started to take care of the teeth and create an oral hygiene program of cleaning the teeth a few times a year plus brushing the teeth, could we prevent this?" Which is where we're at today, with over 50% of Americans going to the dentist to keep their teeth clean. And it certainly probably isn't even enough, but it's made a huge impact on the amount of dental cavities and teeth being pulled. And so we're in this situation right now that dentists were with teeth in the early 1900s as we are now with spines rotting and degenerating and joints rotting and degenerating. And so the most common joints today that are degenerating, number one is the spine, the neck and the back. And this is $100,000 surgery and industry per patient over the course of their life. Second is the knees and the hips, which is cost for replacement for that. It's about $49,000 to $50,000, okay? Shoulders, and then the hands and feet. Now the hands and feet, the arthritis there is going to be more autoimmune disease, rheumatoid arthritis. And so There has to be a way to change this, and we know there is because we've seen this over the years as we've taken care of patients in preventing arthritis from developing anymore. And we're going to talk more about this in further videos, but we're developing a joint and spinal hygiene program because we know that through correct biomechanics, through correct muscle stability, and correct range of motion, that this is something that can actually be prevented. And so our movement is to start reducing the spinal decay and degeneration that's happening within the spines and creating so many problems within people. Check out our other videos that we have on spinal hygiene and arthritis so you can continue to educate yourself on this epidemic that's happening and the steps that are going to be made to prevent those things from continuing to develop.